Welcome to another episode of Voices of Inclusive Research podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today I'm coming to you from the Health Equity Congress Conference in Atlanta, Georgia. We want to bring to you something special, the powerful voices of inclusive research from all the wonderful people working hard in this field. You'll hear directly from them why inclusive research matters and what drives their passion. But before we dive in, I have a couple of exciting announcements for our listeners. You are invited to our Spring Into Action Charity Gala in San Diego, California on May 16th at the beautiful Handerly Hotel. Join us from 6 to 10 p.m. for an inspiring evening of community purpose and celebration. And the next day, come to our second annual Community Clinical Trial Health Forum on May 17th from 12 to 5 p.m. at Mid-City Church in the City Heights area. There you will connect, learn, and be empowered with knowledge about clinical research and health equity. We'd love to see you there. Now, let's jump into today's episode and hear why inclusive research matters right from the voices on the front lines here at the Health Equity Congress Conference.
Hello, I'm Maya with Superior Clinical Research.
Okay, Maya, why does inclusive research matter to you?
Inclusive research matters because the medicine that we are working on and the treatments we are working on are tested on people that don't look like the population that is taking the medicine on a daily. We want to make sure that we include the people who are being affected.
Hello, my name is Leah, everyone's favorite business development associate from Superior Clinical Research. Inclusive research matters to me a little bit more because I grew up with PCOS. And I didn't know about it. And I went through 3 doctors and asked them questions, and they really didn't tell me anything about it. They just said, oh, your period will even out when you get older. Mm-hmm. And it wasn't until I got 20 where I was saying to my new gynecologist, and she was like, oh, it sounds like you have PCOS. And she was another woman of color. And she immediately spotted exactly what was wrong with me and told me exactly what it is that I needed to know. And she took that time with me that I never would have got anywhere else. And then she ended up telling me about things I could and other things that I can read and know about. And now I feel more comfortable asking questions, wanting questions. And now I look for people who look like me or have something similar to me to help me.
Yeah, my name is Paula Atkinson, and I work with the Global Alzheimer's Platform Foundation.
Okay, Paula, tell us why inclusive research matters to you.
So inclusive research matters to me because I am a strong believer that one size doesn't fit all. And I think that when we're thinking about our healthcare, everyone has different concerns. And for me specifically, I just think about the fact that even just with my regular daily routine, there are certain things that I do that when you compare to my husband, he does something completely different to try and live a healthy lifestyle. So similarly, when we're thinking about medicine, when we're thinking about addressing any of our health concerns, that one size fits all, that one medication, it can't go for me and go for everyone else. So inclusive research matters because we need representation from everyone, all walks of life, all age groups, no matter your race or ethnicity. We need everyone involved so that we can know that we have solutions for everyone.
Tony Wayford, I Choose Life Foundation.
Okay, Tony, tell us why inclusive research matters to you.
Inclusive research matters to me because God may have created us all equal, but medicine don't always do the same. What may work in one culture may not work in another culture. And I think it's very important that we be involved in clinical trials and research. If nothing else, especially for someone like me at my age, what better legacy could I leave for my children, my grandchildren, than to create for them the good world that I want for them and that they deserve to live in.
Hello, my name is Brittany Gerald. I'm a clinical trial health equity leader and co-founder of Pathway to Pharma.
Okay, Brittany, thank you. Tell us why inclusive research matters to you.
Inclusive research is important to me because early in my career as a CRA, I went to many different sites, but never saw any patients that reflected my father, who has a number of health conditions. Inclusive research is important for us to include those who will be taking the drug and also have certain comorbidities. It's something that's very important as we think about drugs that are not only taken today, but also many years in the future.
Hi, I'm Mia Chester with the Global Alzheimer's Platform Foundation.
Thank you, Mia. Mia, tell us why inclusive research matters to you.
Inclusive research matters to me because I think it's important for everyone to feel included and to feel as if the medications or drugs on the market will work for them. Oftentimes, we know that clinical research is represented by a specific type of person, and we want to make sure that it does not just fit the mold of one person, but for many people. We work in our communities to ensure that everyone has access. And so all access is a big topic that we think we all need to work towards by offering people opportunities to learn about clinical research or inclusive research, because everyone needs the opportunity to participate and it should be offered to everyone so it can be representative of everyone.
My name is Marcia Calloway Campbell.
All right, Miss Marcia, tell us why inclusive research matters to you.
I so appreciate that question. And to answer it, let me just give you a bit of background and a perspective. I am a lawyer and a consultant, 40 years. In 2017, my life changed. My husband was diagnosed with multiple myeloma. We had never heard of it. So if we fast forward these 40 years, now I am a health equity advocate. I had to become his advocate. And in these 8 years that he's been sick, clinical research has been a topic. I actually last year did a video because a company heard our story and wanted to ask me about clinical research. First of all, we've never in all these 8 years been asked to participate, which blows me away now that I know so much about clinical research. But I'll tell you what I learned just a couple of years ago that changed my perspective about clinical research and who should be included. I learned that not all drugs react the same with all people. I learned that race matters, gender, age matters. And so I started to do this. I started to play this what if game with me. What if, Marcia, you got sick, God forbid? And what if you were prescribed a drug? And what if you took it and time went on and it wasn't effective? And then the doctor says, oh, Marcia, it's not effective. We need to try you on something else. So now precious time has been wasted. So I started to really think about that. In developing that drug, that initial drug they gave to me, if no one was in that trial that looked like me, middle-aged, African-American female, in the trial, if there was no one that met that criteria, they would have had no way to know how effective or not it would be with me. And in my scenario, it wasn't effective. And again, now I've wasted time. So that has changed my perspective. Inclusive research is critical of everyone. Everyone needs to be involved in the trials. And that's where I am now. I appreciate the question.
Thank you so much.
Hi, my name is Melissa Lewis, and I'm the VP of Strategy and D&I Growth at Axon Communications.
Awesome. Melissa, tell us why inclusive research matters to you.
Well, inclusive research matters to me because my family, my friends, my community matters to me. And everywhere I turn, those circles are being afflicted by disease, obesity, hypertension, cancer, Alzheimer's, Parkinson's, you name it. I'm seeing it in my family, with my friends, and in my communities. So for my children and for those circles, my loved ones, to have an opportunity to have a better chance at better health outcomes for the future, inclusive research matters now.
Thank you so much.
Hi, I'm Janae Austin Todd with the Global Alzheimer's Platform Foundation.
All right, Janae, thank you for speaking today. Tell us why inclusive research matters to you.
Inclusive research matters to me, particularly working with senior populations and those with diseases that do not have cures, like Alzheimer's disease or even cancer, is important to me because for folks who don't have that continuity of care or there aren't therapies that work for them, particularly for folks in our communities, Black and Brown individuals, it gives them possibly a new lease on life, a better quality of life. So thinking about, my grandparents that suffered from cancer, different cancers and Alzheimer's disease, if they were knowledgeable about clinical trials, education and outreach is also passion of mine to those communities, they could have possibly, lived longer. So that's why inclusive research is important.
Thank you so much.
Thank you.
Hello, I'm Joshua Travis with the Alzheimer's Association and our All's Brain Trust Project.
Awesome. Okay, JT, tell us why inclusive research matters to you.
Inclusive research matters to me selfishly because I want the cure for all diseases out there. There are diseases like Alzheimer's that does not discriminate between who you are, what you love, or what you want to do. It is a disease that can affect anybody. And so if we can get a cure there, it helps me, it helps every future generation. But in reality, we're all a part of this. So again, everyone has a skin in this game, and that's why you need to be involved in research. We need to make sure that it works with every community, no matter what you're going through, no matter what your health outlooks looks like, you're able to get access and support. So that's why it's really important.
My name is Tamika McGee Rogers, and I work with the Global Alzheimer's Platform Foundation.
All right, Tamiko, tell us why inclusive research matters to you.
Inclusive research matters to me because I have been working in clinical research for the past 17 years, and I have seen strides, right, to ensure that there is representation across clinical trial sites, staff, PIs, and participants. But I think we could do more. And I'm here to make sure that we do, right, that we're disruptive, and we make sure that representation is across the board to ensure that drugs work for everyone and not just one subset of the population, especially working in the Alzheimer's space. We typically see representation about 1 to 5% of those that are enrolled in Alzheimer's trials, but Black individuals are affected twice as likely to be diagnosed with Alzheimer's compared to non-Hispanic whites. And Hispanics are 1.5 times more likely. So with that, we definitely need to ensure that clinical trials are representative of the populations that are affected with these diseases, specifically Alzheimer's. So that is why inclusive research matters to me.
Thank you so much.